Greetings, this is a coronavirus COVID-19 update for 2/25/2020. So we start out every day looking at the Chinese numbers, and the Chinese numbers have been really slow to get up here lately. You can see this was updated to at 2020 2/26/11/47, so that would be about noon China time on the 26th. They're finally publishing numbers from the 25th. So they're about 12 hours behind, and that makes it a whole day behind in the United States. So, and when they do publish these numbers, there's only a few hours during the day where you can actually see the delta numbers that you're seeing on this page. Underneath, like confirmed diagnosis, there's 45,622, and that's a change of down 2,063 from the day before. So the delta number, the smaller number that you see underneath each one of these 6 numbers, that's the change from the day before. So that stays up there for a little while, and then China resets it to 0 because, like right now they're already at noon on the 26th. So that number will reset to 0 pretty soon. And the other numbers will just start changing by whatever is going on. So let's just go over these numbers really quick. Confirmed diagnosis, that's from not only blood work, but microscope work. So they actually look at your blood to see if you have a virus. So that requires a very, very powerful microscope, since there's a zillion viruses can fit on one human cell. So they're really small. So, that's the way they used to do everything. And then they came up with some other tests, which include blood tests and CT scans and stuff like that. So that would be cumulative diagnosis. So that 78,190 is the total number of cases right now confirmed in China, confirmed through the old way of confirmed diagnosis and all other acceptable ways. So that 78,190 includes the 45,622. Suspected cases for today are up 439. Cumulative cures, which is a deceiving topic because these people weren't cured, they just recovered. The mortality rate for this virus is 2.5%. So not too many people are going to die who get it. And most people who get confirmed with coronavirus, they have flu symptoms for a few days, and then they're okay. So this is a little bit misleading to see that many people were cured. Naturally, not that many people were cured. They just, the virus didn't hit them too hard and they recovered. So that's at 29,850, and that's up 2,422 from the day before. So that's a good number to be going up. And then existing severe, these are intensive care unit people. Either you're on a respirator because you can't breathe, or your heart is too weak. So this would be usually old people, and the virus attacks the organs, and they wind up in intensive care. And in cumulative deaths, so far there's been 2,718 people die in China from coronavirus. Then if you scroll down further on the same page, and I'll have the link below in the description for Baidu, the first thing you see is this map, and the map's not changing much every day, except for in Heilongjiang province, which is a northern Chinese province just under that. The long province stretching across China is Ni Mongolia, and then underneath that is a few other provinces, and there's one that's dark red there, and that could be Harbin. I guess I should confirm that before I guess. Then if you scroll down further, you see the first graph that they publish every day, and this graph plots added suspected cases with new diagnosis. So 439 new cases today, 411 newly diagnosed cases today. And this is the second graph, which is below the first one. Just scroll down. And this shows the national number. There's 411 new cases today, and that includes 401 from Hubei province, which is where Wuhan is located, the city of Wuhan. And then it shows a graph of the gold color, and that's non-Hubei province. So there's only been 10 new confirmed cases in all of China outside of Hubei province, and there's 401 in Hubei province right now. So these numbers are dying down a lot. You see these graphs are going down, which is good. Unfortunately, that's not what's happening in the rest of the world. Then if you scroll down further, you see a list of all the provinces, and by default this opens to Hubei. So if you just close Hubei by clicking on that little down arrow on the left, you can see all the provinces. And what's alarming here is we have Henan province with 19. That's a neighboring province to the west of Hubei province, between Chengdu and Wuhan, basically. And that's at 19, which is really high for a province outside of Wuhan, a province outside of Hubei. And then Heilongjiang province, which is where Harbin is, the International Ice Festival, was probably responsible for a high number of deaths in that province, because it happens every year. It starts around mid-December, and I put out a notice to all of my Chinese contacts when it opened, because the weekend that it opened, the air pollution was so bad, and by bad I mean over 600. The air pollution level over 600 particles per cubic meter. So I put out a message to people that said, don't go today. You won't be able to see the ice festival. It'll be, you won't even be able to see buildings in front of you, cars in front of you. So that got, it had some bad weather at the beginning, and then it got shut down early. So that could have been a lot worse. But, China canceled, the New Year's, Chinese New Year's festivals all across China to keep people from gathering in big groups. And that's when they closed this International Ice Festival. Then if you scroll down further, you can see some search topics for today. Like I said, Baidu is a search engine. So every day you'll see these topics, search topics that are related to the coronavirus. And the number one all day is the dynamics, the numbers. Looking up Baidu's numbers, which is the numbers that we just went over. So that's the number one topic in China right now, is everybody wants to see what's the new numbers for today. Then there's a few other stories here, and I usually take a look at a couple of these stories. Wuhan outsiders sleep on the street to pick up leftovers. Something went viral. I guess there were some foreigners, and they were sleeping on the streets of Wuhan, which is unusual because Wuhan is under lockdown. Shouldn't be anybody outside you're only allowed outside during certain hours, and if people are outside after that, they must be street people, and these were foreigners of some, I couldn't tell where they were from. Can't even tell if they're Asian or not. So anyways, I looked at that article, and then Iranian Deputy Minister of Health confirmed new coronary pneumonia. So this is a little weird, because this guy, came out and made a statement that, everything's under control in Iran, and there's nothing to worry about. So here he comes down with coronavirus himself. A little crazy. And then down on the bottom, this is just something that, it's kind of strange. It says somebody came out with a statement and said you should be changing your mask position every 2 or 3 hours. So, that's one way to look at it. You should also change your mask every few hours. They're not made to be, worn day after day after day after day. They capture some, particles, and, could be viruses too. But you just don't keep wearing them. You shouldn't keep wearing them forever. Okay, so we'll take a really fast look at these stories. So up on the upper left, change mask position every 2 to 3 hours. I don't really know what that does. If you're going to put a picture up there and show a guy, you should show the right mask. And this is not a virus mask. So this, if everybody wore this mask, it would be effective. But the problem is it has an exhale valve. It's not made for a virus. So it's a copy of like a 3M, N95 mask, and it has an exhaling valve in it, which means when you exhale, your breath is not being filtered on the way out. It just goes right through that valve because the valve just has a little, like a diaphragm, of rubber or some kind of flexible material, and it just opens and lets you exhale. So in other words, if you had coronavirus and you were exhaling, you'd be spreading it all over everybody. But if everybody had this mask, that does prevent you from inhaling the virus. So it's quasi-effective. Then on the upper right was that story about the foreigners, and I don't know who's foreigner in this picture. Just looks like some people with masks can't even tell where they're from. And then on the bottom you can see the Iranian Minister of Health talking about, or he's listening to a speech, but he's wiping sweat beads off of his head because he's got a fever. And the next day he came down with the virus and had some pretty severe symptoms. Then we have the Johns Hopkins. This is a research institute at Johns Hopkins, and someday I'll look that up. It's Johns Hopkins, either the hospital or the university. The research institutes at the university would be funded by, by the university and by tuition and stuff like that, and by private donations. The research institutes at the hospital would usually be the American Medical Association. This CSSE is a research institute somewhere there. I have yet to look it up. And I actually worked at a research institute at Johns Hopkins, but I don't know this one. So anyways, they decided that they're going to create a global tracker. And I've been using this because it's really, the best global tracker out there. So this is today's. This is published about the same time as the last Chinese updates. So we're at 81,000 total cases worldwide, global. So Johns Hopkins is global, and Baidu is China. So the first thing I do when I see this is I take a look at what China's latest numbers are. So China has the total in mainland China is 78,190. And Baidu shows it as 78,064. So we're behind, so you would have to add some numbers to the 81,000 to get the correct number right now. But it's, sometimes it varies by several hundred and sometimes a couple hundred, and here, 130 or 120 something. And, I just look at that to see what the real total confirmed cases are right now. Then I take a look at this is the Johns Hopkins today chart on the top, 81,000, and yesterday's. And I don't really need to look at the difference of these every day because I just know what the numbers are. So, now South Korea is up to 1,146, which is going crazy. And that's because of that, religious cult where somebody got infected and infected a bunch of other people, up to 1,000 people that attended one service. This one person is a super spreader and actually spread the virus around to 40 people personally, they suspect, and could be a lot more than that. And then those 40 people spread it. So now we're up to 1,146, and that includes people. It's the name of the town where this is happening is Daegu, and it's an inland town in South Korea. It's in the southeastern part of South Korea, so it's across the country from Seoul, and real big populations. But this 1,146 includes this religious sect, and then a bunch of hospital people, and hospital administrators and medical people who got infected, and then it spread through the population a little bit. So that's looking pretty bad because South Korea really soared up there. You can see the day before it was 833, now it's 1146, but Just a few days ago it was under 20. So that's alarming. Italy, the same thing is going on. We've got a pretty big spread here, and that's due to the fact it's about the same reason. You walk into your local hospital wherever you live in the United States, and nobody's wearing virus outfits. Nobody's in white hazmat suits with a respirator on and goggles, because there's no virus threat. And then, all of a sudden, when the first person with the virus walks into a hospital, the hospital's not very well protected. And that's what's happening in Italy now. There are 3 little villages up in northern Italy, mainly one, that started, infecting hospital workers, and it started spreading pretty quick because nobody was aware of the virus. Italy just wasn't ready. Neither was South Korea. Neither was Iran. So those are the 3 countries now where there's an alarming rate of increases going on. And Iran is probably higher than 95. That's what people suspect. Because I read in one article where Iran has 50 deaths in one city, and that's probably not 50 out of 95, because the mortality rate is not 50%. And then there's an article here on the right: USC recalls students from South Korea and Italy, because they have students in these countries, and the coronavirus is spreading, and we don't want to wind up with the same issue that we had in Japan with the cruise ship. Then we have the U.S. numbers that goes up a little bit every day, but the U.S. was at 16 cases just a few days ago. We picked up number 15 in Texas, and then number 16 back in California. And of those, I think there were 11 people that were either released from the hospital or about to be released, who were cleared of the virus. So the U.S. number was pretty low, and the reason it hopped up to 57 is because we had people on this cruise ship, this Diamond Princess cruise ship. There were supposedly 45 Americans infected with the virus on the cruise ship out of about 100 passengers. So I don't know who was doing the testing on the cruise ship. Probably Japan, somebody in some health administration in Japan. I don't know if it was the city where they were docked or what. But these people were repatriated back to the United States now. So that number, 16 increased up to 57 so far. So we are also retesting these people to see if they're confirmed cases or not. So it's not that alarming, because the American citizens that we're bringing back are isolated. They're isolated on this plane. They'll go to a base where they're going to be together in quarantine for 14 days. And then there's some infected people will go to the hospital, but they're not out in the public, so they can get other people sick. And also in the background, you can see the graph on the lower right of this Johns Hopkins thing. We're going to take a look at that graph by expanding it, which is clicking on the upper right-hand corner of that graph. So I always put these red lines on the graph just to see what trends are, to see how things are looking from one day to the next. And as you can see, the first few sections of days that I lumped together, the first couple, the virus was increasing a lot, accelerating. We had more cases every day. It was up to like 3,800, 4,000 new cases every day for a few of those days. And then it died off a little bit. And then we had the big aberration around February 12th and 13th and 14th. And that's due to the difference in the criteria that is used to determine whether a case is confirmed or not. First, it was blood tests only through a microscope, and then other tests were added and accepted. So there was a big, huge jump of 15,000 cases in one single day, because they included all the other cases with all criteria that somebody deemed was capable of confirming a case. Then we kind of went through a 5-day period where things were about the same as they were before this aberration. And then it started slowing down. You can see between February 18 and, let's see, 18, 19, 20, 21, those 5 days or those 4 days was kind of steady. It was leveling off as far as new cases. Now the number of new cases is accelerating again, but it's not due to China. It's due to Italy and South Korea and Iran and other countries that are picking up some stuff now. There's some cases in Croatia that came from Italy, and the virus is spreading, but so far it's spreading in small numbers, and hopefully it won't be a really bad global pandemic. And if it is, we're going to have to use the Chinese model, as they say, and that's lockdown, citywide lockdowns. People stay inside. That's all we have. Thank you.